Welcome to introductory module of our Wound Care Certification Program. Why Wound Care Matters, Impact, Challenges, and Opportunities. Before we begin exploring techniques, tools, or treatment protocols, let's take a moment to understand the why. Why does wound care matter? Why is it not just a clinical responsibility, but a human one? And why are nurses, you, so uniquely positioned to change lives through it? This session lays the foundation for everything that follows. You'll see how wound care affects millions globally, physically, emotionally, socially, and financially. You'll discover the obstacles that make healing harder, and the opportunities you have to rise as a champion of change. Let's set the stage together for a transformative learning journey. Let's begin by breaking a common myth. Wound care isn't just about changing dressings. It's science, yes, but it's also strategy, skill, and soul. It's a clinical practice rooted in microbiology, pathology, and pharmacology. But it's also a compassionate act that restores confidence, relieves pain, and preserves dignity. In today's world, wound care is becoming more critical than ever. Why? Because of rising rates of diabetes, vascular disease, surgeries, and aging populations. That means more wounds, more complexity, more lives impacted. As nurses, we are not bystanders in this crisis. We are first responders, care coordinators, educators, and most importantly, healers. You might be the one to notice a pressure injury before it worsens, or the one to explain wound dressing to a family caregiver who's feeling overwhelmed. You may be the one to say, let's talk to the dietitian, or the one who advocates for a better mattress, a safer discharge plan, or simply more dignity for the person behind the wound. This module is about helping you see the bigger picture, because wound care is not a task, it's a mission. Now that we've set the context, let's talk about what you'll learn in this session. Objective 1. You'll be able to describe the true burden of wounds, both acute and chronic. We'll explore statistics, real-life stories, and what they reveal about trends, risk factors, and the human cost of wounds in our communities. Objective 2. You'll learn to explain the economic and psychosocial impact of wound care, from hospital bills to lost income, from mobility loss to mental health decline. We'll unpack how wounds affect not just patients, but families and healthcare systems. Objective 3. You'll identify key systemic challenges like delayed diagnoses, care gaps, and workforce training shortages. We'll look at what's holding us back and how we, as a healthcare comm, Objective 4, and perhaps most importantly, you'll come away with a clear picture of your role as a nurse in improving wound outcomes. From bedside to boardroom, from home health to hospital wards, your voice, your vigilance, and your values matter. This isn't just about becoming a better wound care provider. It's about becoming a stronger advocate, educator, and leader. So, let's get started with knowledge, purpose, and heart. Unity can address those gaps head on. Let's put this into perspective. Over 6.5 million Americans are currently living with chronic wounds. These aren't just small scrapes or cuts. We're talking about pressure injuries from prolonged immobility, diabetic foot ulcers, a leading cause of amputations, venous leg ulcers from circulatory disorders, and non-healing surgical wounds that linger for months. These conditions aren't rare complications. They're common realities in hospitals, long-term care, and outpatient settings. So, who's most affected? It's the people we see every day. Older adults with fragile skin and comorbidities, patients with diabetes, who often lose sensation and don't notice wounds until it's too late. Individuals with limited mobility or poor circulation, whose bodies struggle to repair damage. This is not a marginal issue, it's a public health emergency. When you realize how many lives are touched by wounds, you understand why wound care isn't a specialty. It's a core competency for every nurse. Let's now look at the numbers, and they're staggering. According to Medicare, The annual cost of wound care ranges from $28.1 billion to $96.8 billion in the United States alone. That includes direct medical costs, dressings, diagnostic imaging, surgical procedures, hospital admissions, but also indirect costs that are harder to measure, yet just as devastating. Missed workdays or job loss, long-term disability, increased dependency on caregivers, extended use of assistive devices, or home modifications. But there's more. Wounds don't just drain wallets, they drain lives. Imagine a working adult who suddenly can't stand for long shifts because of a non-healing foot ulcer, or an elderly person who's re-hospitalized every few weeks because their wound keeps getting infected. The cost? Not just financial, it's personal, it's emotional, it's about lost potential and diminished quality of life. That's why timely, evidence-based, nurse-led wound care isn't a luxury. It's a cost-saving, life-saving intervention. Now, let's go deeper, beyond the skin, beyond the spreadsheets. Chronic wounds don't just affect the body, they erode the spirit. There's the constant pain, sometimes burning, sometimes stabbing, often relentless. The odor from infected or draining wounds can be humiliating, prompting patients to avoid social gatherings. The appearance of wounds, especially on visible parts of the body, can devastate one's self-image and confidence. And the consequences? Depression, often unrecognized and untreated. Social withdrawal, patients stop attending family events or even medical appointments. Loss of independence, when a person can no longer bathe, dress, or walk without help. This emotional toll can create a vicious cycle. Depression leads to poor self-care, which worsens the wound, which leads to more depression. As nurses, we must look at more than the wound bed. We must see the person behind the dressing and address the invisible wounds they carry. This is why holistic, trauma-informed, compassionate care isn't optional. It's the heart of what makes us not just caregivers, but healers. Let's take an honest look at the barriers. Wound care has incredible potential, but right now, several critical challenges stand in the way of success. First, delayed detection. Too often, pressure injuries or infections are caught late, when damage is already deep and healing is harder. Next, fragmented care. A patient might move from hospital to home to rehab, and with every transition, information gets lost, dressings change, plans shift. Consistency is missing. Antibiotic misuse and resistance. Over-reliance on antibiotics fuels resistant organisms. Add biofilms to the mix, those stubborn colonies of bacteria, and even the best medications can fall short. Lack of training. Many frontline nurses haven't had access to formal wound care education. They're expected to manage complex wounds with minimal guidance. And finally, social determinants of health. Poverty, unstable housing, poor nutrition, limited healthcare access. These real-world issues make prevention and recovery incredibly difficult for many patients. Addressing these challenges requires more than good intentions. It requires innovation, education, and a systems-thinking mindset. Here's the good news. Nurses are perfectly positioned to lead the change. We are not just caregivers. We are connectors, educators, and advocates. Here's what that looks like. Early assessment and documentation. We're the first to notice skin changes, and our documentation guides every step that follows. Dressing selection and infection control. We choose and apply the right products. We prevent contamination. We are the guardians of wound hygiene. Patient education. From hand washing to protein intake, we teach the small steps that create big healing wins. Interdisciplinary coordination. We connect the dots across specialties, ensuring that wound care doesn't end when the shift does. When nurses lead wound care with confidence and compassion, outcomes improve and lives are changed. To make a real impact, we need more than individual efforts. We need system-wide solutions. Here's how we begin. Interdisciplinary models of care. Imagine a team where nurses, physicians, wound specialists, dietitians, and physical therapists all collaborate seamlessly. That's patient-centered care. Standardized clinical protocols, clear, evidence-based guidelines for different wound types help reduce variation and improve outcomes, whether you're in a rural clinic or a major hospital. Technology digital wound photography, documentation apps, and telewound consultations bring expertise right to the bedside, even remotely. Continuity of care, structured discharge plans, home health coordination, and follow-up protocols ensure that no patient falls through the cracks. These changes aren't futuristic, they're happening now. And with the right training, you can help lead the transformation. Let's bring it all together. Wound care isn't just about bandages. It's about human dignity, mobility, mental health, family connection, financial security. It affects millions. It costs billions. And it changes everything for the patients who live with chronic or painful wounds every single day. But there's hope, and it starts with you. As a nurse equipped with knowledge, empathy, and a systems-based mindset, you can move the needle on outcomes. You can prevent suffering. You can create healing environments wherever you go. So, thank you for stepping into this space with commitment and courage. This is only the beginning. Let's take this journey together, one wound, one patient, one powerful nurse at a time.